you probably wouldn't voice it openly. Not while lifting weights at the gym, not during a meeting at work, perhaps not even in a private conversation with your best friend, but allow me to pose the question straight to you. Have you ever silently pondered, am I truly normal? Rest assured, you're far from being the only one. In reality, research surveys indicate that over half of all men harbor concerns regarding their dimensions, despite the fact that most of their partners express complete satisfaction. Nevertheless, the online world is saturated with instant solutions, wonder supplements, and questionable operations that vow dramatic outcomes, yet frequently result in men feeling disappointed, worried, or in an even poorer state than before they began. Therefore, right now, I aim to slice through all the clutter, and I will guide you step by step through exactly what scientific studies reveal concerning enhancing penile length, which approaches prove effective, which ones fail entirely, and the essential knowledge every man past the age of 40 needs to safeguard his well-being, self-respect, and self-assurance. However, prior to proceeding any deeper, a brief intermission. Should you appreciate straightforward, research-backed guidance on health matters, feel free to click, press subscribe, and leave a note mentioning your current location as you view this. It assists the channel in connecting with additional men who desperately require this important discussion. Okay, let's plunge right in. Here's the reality that rarely gets mentioned. The vast majority of men who fret about their size fall squarely within the normal category. The typical erect penile length measures approximately 5.2 inches, and nearly all individuals reside inside a standard healthful spectrum surrounding that figure. Yet the issue lies not with the physique, it's rooted in the psyche. A disorder known as small penis anxiety is growing more prevalent by the day. This involves men dedicating an hour or greater each day fixating on their dimensions, despite being entirely within biological norms. And this isn't merely innocuous rumination. Such anxiety has the potential to devastate self-worth, harm romantic partnerships, and even trigger depressive episodes. Thus, before delving into gadgets, operations, or therapies, we must shatter the most enormous falsehood of them all. The idea that a man's value is determined by measurements on a measuring tape. It simply isn't true. Having acknowledged that, scientific inquiry does provide certain pathways, and this is precisely where my expertise comes into play. In case this is our first encounter, hello, I am Dr. Rachel Collins, a board-certified urologist possessing more than a decade of hands-on practice assisting men in gaining mastery over their sexual and urinary wellness. My professional journey has been dedicated to distinguishing reliable information from falsehoods, extending beyond academic texts into actual dialogues with countless men who have confided in me from the opposite side of the desk, nervous, mortified, or merely inquisitive about this very topic. And this is my commitment to you. I will refrain from any sensationalism. Instead, I deliver substantiated facts. Now, let's examine in detail the 5 primary habits and errors men commit regarding penile length, along with what empirical evidence suggests for altering them. Habit number 5, fixating on comparisons drawn from pornography. We begin with the unseen snare, unrealistic benchmarks. Adult entertainment has profoundly distorted men's understanding of typical anatomy. Viewers encounter hand-picked actors, frequently representing the upper 1% in terms of size, causing the mind to reconfigure its standards, convincing you of personal insufficiency. From a biological standpoint, your anatomy remains unchanged, yet your neural pathways have shifted. Repeated exposure triggers dopamine surges that establish warped reference points. On an emotional level, these comparisons gradually erode self-confidence. You might experience shame, evade closeness, or cultivate issues with sexual performance. From a practical perspective, the solution does not involve abandoning intimacy altogether. Rather, discard the flawed comparison tool. Constantly reinforce in your thoughts that your significant other prioritizes emotional bonds, attentiveness, and overall capability far above any numerical value on a ruler. Now, regarding tangible bodily modifications, let's explore that territory. Habit number 4, pursuing supposed miracle tablets or injectable treatments. Enter the phrase, how to increase size into a search engine, and you will be overwhelmed by promotional materials for natural remedies, potency-boosting capsules, and mixtures for injection promising overnight metamorphosis. Allow me to deliver the stark reality. Not a single one of these has demonstrated safe, reliable enlargement of penile length. Biologically speaking, numerous injectable options lead to fibrous scarring, malformations, or irreversible impotence, with effects manifesting even years down the line. Emotionally, individuals enter with optimism, but exit burdened by remorse and humiliation if complications arise. Practically, I implore you, for the sake of your well-being, steer clear of introducing uncontrolled compounds into your system. Your organ is immensely valuable to risk in such a manner. Therefore, since oral supplements and injectables fall short, what alternatives exist? Habit number 3, overlooking traction-based therapy. This stands as one of the scarce methods backed by scientific validation. Devices designed for penile traction, when applied diligently across several months, have demonstrated moderate gains in length, typically in the vicinity of 2 centimeters. Biologically, they function through the application of mild, continuous pull, encouraging cellular regeneration and adaptation. The principle mirrors how dental braces gradually realign teeth over extended periods. Emotionally, advancement occurs gradually, demanding perseverance. However, for those who persist, the mental uplift from observing verifiable progress can prove transformative. Practically, this entails multiple hours of wear each day, frequently spanning 6 months or beyond. Outcomes remain humble rather than spectacular, and one must be prepared for possible temporary drawbacks, such as desensitization or minor contusions. Yet, what of surgical intervention? Does it offer a faster route? Allow us to address that. Habit number 2, hastily opting for operations without grasping the dangers involved. Procedures for surgical elongation do exist, though they remain largely investigational and accompany substantial hazards. From a biological viewpoint, techniques such as cutting the suspensory ligament might create a longer appearance in the flaccid state, but they fail to alter erect dimensions and may compromise stability during arousal. Additional operations incorporating grafts or prosthetic inserts frequently yield low contentment levels. Emotionally, numerous patients emerge from the operating room experiencing not alleviation, but profound disappointment. Rates of unhappiness soar because anticipated results seldom align with actual experiences. Practically, absent participation in a rigorously supervised research study, pursuing surgery solely for extension purposes is unequivocally inadvisable due to the elevated perils. This leads directly to the most critical blunder overall. Habit number 1, disregarding psychological well-being. This forms the foundational concern. Biologically, your mind serves as the paramount erotic instrument. Worry commandeers your autonomic responses, elevates cortisol levels, and genuinely impairs erectile capability. On the emotional front, once men confront their unease via professional therapy or guidance sessions, data reveals that most cease desiring any physical alterations whatsoever. Practically, channeling resources into mental wellness enhances not only bedroom assurance but every facet of existence. Improved rest, stronger connections, elevated spirits, superior functioning. Thus, should a single takeaway linger from this presentation, make it this. The most profound expansion attainable is not measured in length but in self-belief. Allow me to outline your straightforward action plan. Cease detrimental parallels. Reduce exposure to adult content. Emphasize genuine closeness. Evade fraudulent schemes. No capsules, no shots, no dubious practitioners. If intrigued, explore traction apparatuses, maintaining tempered expectations and unwavering routine. Reject surgical options outside formal trials. The downsides outweigh benefits. Place mental health at the forefront. Therapeutic support has the power to revolutionize outcomes. This constitutes the pathway to restoring both physical vitality and inner tranquility. Permit me a moment to address you personally. If this concern has weighed on you for years, listen closely. You are neither defective nor atypical, nor are you isolated in this. A man's merit is not quantified in centimeters. It is gauged by your presence in partnerships, your commitment to wellness, and your poise. Absolutely, you retain the capacity to elevate these areas regardless of age. Here is my proposed task for you. Abandon pursuit of legends. Commence cultivating routines that shield your form and fortify your intellect. For ultimately, true liberation stems not from yearning for alteration, but from embracing assurance in your identity while pursuing intelligent, secure advancements toward your optimal self. Should today's content prove beneficial, kindly assist by selecting the like icon, subscribing to the channel, and posting a response underneath. Which single wellness practice are you prioritizing this year? I am Dr. Rachel Collins, underscoring that your significance is not gauged by dimensions. It is reflected in your manner of living. Care for yourself. You deserve it.